Hello everyone, this is HIM 225. We're covering chapter 20 in your textbook, and I apologize for the abrupt end to lecture 1. We were talking about the difference in coding an acute injury, which comes from chapter 19, versus according to this guideline on B, following this guideline on B, that bone, joint, and muscle conditions that are the result of healed injuries are usually found in chapter 13. And the example that I was trying to give you is concerning a dislocated shoulder. When you dislocate your shoulder, and that is an acute injury, that code is going to come from chapter 19. And I'll show you. If we go to dislocation shoulder, we can see that that code is SP21.006. It's in chapter 19. Now, if we're going to code a recurrent dislocation of the shoulder, you'll see that there is a subterm here for chronic, and it says see dislocation recurrent shoulder. I don't know why they can't just have shoulder and then have a subterm for recurrent right here. Because if you're just going and looking at dislocation of shoulder and you don't read carefully, you'll miss this, and students miss it all the time. So if we go to dislocation, did it go there for me? Yep, so if we go to dislocation, recurrent shoulder, look where we go. M24.41, and then of course we have laterality that we will choose for that code. So I wanted to demonstrate that for you. You have to really think about what you're coding, and for this chapter, if you're coding an acute injury and you end up in chapter 13, you may want to go back and take another look at that. Of course, with regard to the pathological fracture that we were looking at, you do need to be in chapter 13. Now, on the top of page 475, we're looking at osteoporosis. And this is where your textbook does tell you that, or the guideline tells you that it's a systemic condition, meaning all the bones of the musculoskeletal system are affected. It then goes down and talks about the category M80, which is osteoporosis with current pathological fracture, is by site. It's coding the fracture by site and not the actual osteoporosis. Category M81 is osteoporosis without a pathological fracture. And it does point out here that for patients with a history of osteoporosis fractures, there's this status code, and we looked at that in the index in the last lecture, and it tells you that that code should follow the code for M81. And then it is the guideline for using category M80, which is osteoporosis with a current pathological fracture. I want you to carefully read this chapter. Many times when we're doing orthopedic coding, and that's what this is going to be, is orthopedic coding, the terms that are used to identify the part of the body are very important. This talks about anterior or ventral, posterior or dorsal, medial, lateral, superior, inferior, cranial, caudal, proximal, distal. You need to know what these terms mean. You need to be able to visualize what you're reading in your head. And if you start reading something and it has a lot of these kind of terms and you're not sure what they are, stop and look them up. It talks about positioning patients. Supine refers to lying on your back face up. Prone is lying on your stomach face down. And When you're reading operative reports, one of the first things that the surgeon will dictate in that report is how the patient was positioned for that procedure. So it goes over terminology. You should be familiar with that. Look carefully at these figures on page 476 and 477. It can be very challenging to code things from this chapter if you're not familiar with anatomy. You may need to go into 3M, go into the references, and look at those anatomy plates. And then on 478, these are the different directions and planes of the body you need to be familiar with. In radiology, they absolutely are familiar with these, and so you need to read those and try to understand those. This is a good chapter. It has a number of figures, help you visualize what they are talking about. When we are talking about the spine on page 484, you need to know where the cervical vertebrae are, the thoracic, the lumbar, the sacrum, the coccyx. You need to be able to visualize when you're reading those. Pathological fractures and fracture aftercare begins on page 487. Osteomyelitis, an infection of the bone. And basically, if a patient gets osteomyelitis and they can't treat it with antibiotics, they can't debride it, they have to amputate it. And then we have the Z codes that are on, there are a lot of Z codes in this chapter. They start on 489 and go all the way to 491. And it's because they have a site and laterality included in them. You can go back to page 479, and we're going to look at looking up some of these codes. And on page 479 under osteoarthritis, patient has primary osteoarthritis of both hips. In the index, if we go to osteoarthritis hips, we do see that there is a bilateral code here, M16.0. So this is an example of when we do have multiple sites coded for us. Now, if we look at this second example on 479, patient is being treated for osteoarthritis, hands and wrists. So we have both hands and we have both wrists. If we go into the index and look at osteoarthritis, and then you'll notice we don't have this documented as primary, secondary. So if we just go to osteoarthritis and generalized, we will see this code M15.9. And this is in the category for polyosteoarthritis. It includes arthritis of multiple sites. So I wanted to, because otherwise what you would end up doing, which would not really represent this generalized arthritis, is you would be assigning 4 codes. One for the right hand, right wrist, one for the left hand, left wrist. And when you use the actual encoder and run this through, depending on how you use the answer the questions and use the algorithm, it either takes you to all 4 codes or it takes you to this generalized code for multiple sites, which is M15.9. So I wanted to show that to you so you could see how we got to that code. If you're trying to go in and code these, it can be confusing if you don't realize that in this particular example, because we don't have the type of osteoarthritis specified, and because it is generalized, it's in multiple parts of the body, we choose this generalized code. On page 481, we are talking about collagen diseases, and the example is a patient being treated for CREST syndrome. And in this particular example in the index, you can actually type in CREST and find this code. M34.1, CREST syndrome. Now the next one I want you to look at is on page 485. This first example. The patient's MRI showed stenosis of the cervical vertebrae. So we go to stenosis, and if we try to put in vertebrae, there's stenosis, and we don't go anywhere. What we have to do is put in spinal. And when we're at spinal and cervical, we have the code M48.02. In the next example, we have a patient who has spondylosis of the lumbar region with myelopathy. So in the index, when we put in spondylosis, we see with myelopathy, and then we're looking for lumbar region, so we'll find this code M47.16. On page 486, your textbook talks about necrotizing fasciitis. In the index, you put in fasciitis, you'll find the code for necrotizing, M72.6. And when you get to that code, you'll see that you have an instructional note. Use additional code to identify the causative organism. So whatever organism is causing that necrotizing fasciitis, you're going to add a code for that. So let's take a look at coding some of these procedures. So on page 492 and 493, we start off with an arthroscopy. An arthroscopy is an inspection unless something else is done. In the index, you can see that for arthroscopy, we have the option to choose a table for upper joints or lower joints. In this example, it's an arthroscopy of the knee, so the knee is below the diaphragm, and so that is a lower joint. That's the wrong table. That is a lower joint, so it's table 0SJ. And in this particular example, we're looking at the left knee, and this is percutaneous endoscopic, and there's no device and no qualifier. Now, in the next example, they find, when they do the arthroscopy, they find that this patient has a partial tear of the right medial meniscus. So even though the arthroscopy becomes the approach, the procedure is actually a meniscectomy. And so when we get to meniscectomy, we can say knee, and is it the right or the left? And in our particular example, it's the right, so we will go to the table for right to knee, and we're at table 0SBC, and then this is percutaneous endoscopic, so basically we choose the approach, and there is no qualifier, and so that is how we would find the code for that meniscectomy. So arthroscopies, if all they do is inspect, that's fine, but anything else you have to actually code what they did. One of the common procedures that you will code related to this chapter are replacements, joint replacements. And in your textbook, we're looking at a hip replacement. And the root operation is replacement, so I went to replacement in hip. And you can see that there are some options here, partial or total, and then resurfacing only. And sometimes they just go in and do a revision to a hip replacement. They may go in and just do resurfacing. But if they replace the hip we're going to table 0SR, which is actually replacement of a lower joint, and then we would choose which was the appropriate one, and we're going to choose the left hip joint. And when we do that, you can see the procedure's open. That I actually have heard people say that they had a laparoscopic hip replacement. So I'm not sure what they actually had done, but when we do this in PCS to replace the hip joint, that's not an option. Now let's look at resurfacing. Nope, resurfacing is not an option either. So, I mean, open's the only approach here. So when we look at the device that you choose is actually going to be based on what the physician's using, and there are different things that they use. So you'll have to determine that from the documentation, and then also there's cemented versus uncemented. So let's just choose something, ceramic on polyethylene. We can choose that device, and we still have all of the qualifiers available. And of course, the way that it's coded will specifically be based on the documentation. In your book, they tell us that they had a hip replacement. It's a partial hip replacement, femoral surface with synthetic substitute, and that it was uncemented. And so we would, for our let's take these out. Okay, so for our body part, we are looking at, oh, this is a knee replacement, not a hip replacement. Excuse me, this example in the book is the knee replacement. So knee joint femoral surface rate, then we can choose synthetic substitute, and we can choose uncemented. So basically it's just understanding the terminology and assigning those codes. Page 495 talks about a vertebroplasty, and this is used to treat pain caused by compression fractures. The root operation is supplement because they actually are putting in acrylic cement into that collapsed vertebrae to help support it. So in the index, we would go to supplement. If you try to do vertebroplasty, it doesn't come up. So you do supplement vertebra, and then you choose thoracic, and it would be 0PU4, that table. And we know that this was percutaneous and it was a synthetic substitute. It tells us that in the example, and so that is the code that we would apply. Okay, let's go over your homework assignment. For homework, you're answering the odd number chapter review questions 1 through 19. Number 1 has 1 code. Number 3 has 1 code. 5 has 1 code. 7 has 2 codes. Now I want you to notice that this is a patient with osteoporosis due to previous long-term use of steroids. So in addition to the code for the osteoporosis, you're going to have a T code for this. So this is an adverse effect of using steroids. So for that code, you're going to go to the drug table and type in steroid, and you're going to choose the appropriate code for adverse effect, and then you're going to add the appropriate 7th character to indicate that this is a sequela. Number 9 has 2 codes, and this is, you have a diagnosis code for the ganglion tendon sheath, and there is an open removal. Now keep in mind, this is not, you're not removing you're removing a ganglion cyst, basically, so you're not taking out the entire tendon. So make sure that you use the appropriate root operation for this. Number 11 has 1 code. 13 has 2 codes. 15 has 1 code. 17 has 1 code. 19 has 2 codes. In the workbook, you're answering the odd-numbered glossary definitions on page 223 in your textbook. And then you're answering the odd-numbered coding questions 1 through 13. And number 1 has 2 codes. This is a septic left knee joint, and the organism is Staph aureus. For number 3, this is a recurrent dislocation of the shoulder with a reduction of that location, and this is 1 diagnosis code and 1 procedure code. Number 5 has 1 code. Number 7 has 1 code. 9 has 1 code. 11 has 1 code. And 13 has 1 code. So if you have any questions about any of those, please don't hesitate to contact your instructor. Now, your question for this particular lecture, on page 489, exercise 20-6, answer number 3. So, exercise 20-6, question number 3, and that will conclude this lecture.